Just ahead on this edition of Being Well, neurosurgeon Emilo Nardone returns for a discussion about brain tumors. We'll learn more about the different types and classifications and how they're treated. We've got an interesting half hour to come, so don't go away. Being Well starts right now. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Welcome back to Being Well. I'm your host, Lori Casey, and today Dr. Emilo Nardone, neurosurgeon from up in the Bloomington area, has joined us. Last time you were here, we were talking about spinal surgery, and when I asked him other topics, he says, I like brains. Tell us a little bit about your practice and what you kind of cover as a neurosurgeon.
I'm a neurosurgeon, so we deal with the brain and spine and some peripheral nerves. Brain tumors is my passion. I was trained, I did a fellowship in brain tumors, and for the last 25 years I've been dealing with this problem extensively. Of course, another interest is minimally invasive spine surgery. We talked about it last time. So I said, minimally invasive spine surgery has already been covered, so now we have to open the gate of brain tumors.
So just to clarify, your practice is up in Bloomington, but you also come down to Sarah Bush here in Charleston and also up in Champaign.
That's right. I'm based in Bloomington, where the main office is, and we have an office in Champaign and Sarah Bush here in Mattoon, and I come here pretty much every week.
Okay, well, let's get right into it. Let's talk about brain tumors. How common is it?
Well, they are more common than probably the general population thinks. There are approximately 21 brain tumors, new brain tumors diagnosed every year, every 100,000 population. So, in an area like Charleston, Mattoon, for example, with all surrounding counties where there are approximately 170,000 people, there's probably 35 new brain tumors every year.
Wow.
And the incidence of brain tumors in the general population is there are approximately 200 people living with a diagnosis of brain tumor per 100,000 population per year.
Why do you think there's so many new brain tumors coming up every year?
Well, it's not that new brain tumors. I mean, brain tumors have always been existing. We live longer, so because we live longer and we have more access to diagnosis, we diagnose more brain tumors. But brain tumors have always been common.
Okay, so I understand that there's 4 main groups of brain tumors. Can you kind of explain what those are for us?
Yeah, when you tend to classify brain tumors, first of all, you can say it's either benign or malignant. But more than benign and malignant, we want to know where is the brain tumor arising from. So it can arise from the brain itself, and that's one category. The second one will be arising from the covering of the brains, like called meninges.
Okay.
One of the most common one is a meningioma. That's the second group.
Okay.
The third large group is arising from nerves, cranial nerves associated to the brain, attached to the brain. And this is, for example, one of the most common one is what we call an acoustic schwannoma, or a tumor that arises from the nerve that controls the equilibrium and, and hearing. And the fourth main group, that is probably the largest group, the most common group, are the metastatic tumors. What does it mean? Tumors that arise elsewhere into the body, like breast cancer, lung cancer, and eventually ended up going into the brain.
Yeah, you often hear of someone having breast cancer or something that's spread to the brain.
That's right. And those tumors don't belong to the brain. They just get to the brain and grow there.
Okay. So of those 4, is there one that is the worst kind to have or the hardest to treat?
Well, one of the hardest tumors to treat, unfortunately, is the most common tumor in the adulthood. It's called glioblastoma multiforme, that we usually abbreviate as a GBM. It's a tumor highly malignant, arises from the brain, infiltrates the brain, and is very difficult to treat because although we can resect them, they tend to come back, to grow back. Because the tumor's edge tends to infiltrate the brain. And in order to achieve a complete resection, you have to remove the brain. And for obvious reason, that's not possible.
Right.
And that's why the prognosis after so many years of research, although somewhat improved, is still dismal on this type of tumor.
Okay, now you mentioned malignant and benign. Can you explain the difference, and is one more severe than the other?
That's right. We can be even more specific. Benign means that it's a well-capsulated tumor that does not invade the surrounding brain.
Okay, so it's just kind of like a...
It's like a shell,
okay.
a shelled-out tumor, where it can cause a lot of symptoms, but once removed, quite often it can be cured. The malignant one, instead, is the one that infiltrates the brain that even if removed, tends to come back.
Okay.
And that becomes difficult to treat.
Okay, so are there different populations or maybe age groups of people that are more susceptible to getting brain tumors than others?
Well, we have to say that together with leukemias, brain tumors are the most common malignancies in infancy, in children. So they are relatively common. It's probably related to a genetic background, and there's some sort of familiarity in certain group of population. It's not been clearly established a direct link between some sort of environmental pollution and the diagnosis of the development of brain tumor. More recently, there's been more focused on radio frequency waves, cell phones. And, I don't think there's a clear scientific proof to that, but hopefully one day we're going to prove it yes or not.
Okay. Let me ask you, what's your thought on that? Or maybe you don't want to go there. I
have a personal opinion. Okay. I have a personal opinion, and that tells you what my opinion is by the fact that I do not use a cell phone in front of my ears, but I put it on speaker.
Okay.
So it can tell you what I think about it. I think at some point there's going to be a proven link, because in too many cases, people that have used cell phone quite a long time have developed either parotid tumor, so near the ear, or brain tumor near the location of the ear.
So let's talk about the symptoms. I think everybody thinks headaches, and I have a brain tumor, and it's a scary thing. Brain tumors are frightening things, but what are the symptoms of a brain tumor?
Actually, headaches is number one symptom, but not every tumor presents with headaches.
Okay.
Some tumors present with the development of seizures. I just saw a patient a few hours ago where she was doing fine when all of a sudden, lost consciousness and developed what we call a generalized seizures, where the body shakes. She was taken to the hospital, a brain MRI was done, it was found to have a brain tumor. So what happens to a brain tumor? The brain tumor can irritate the cortex of the brain and cause seizures. The brain tumor can develop in certain area of the brain that controls a specific function, like movement, sensation, vision, and so forth. So if the brain tumor is near those areas of the brain, that function is going to be affected. So the brain tumor can cause headache, weakness, numbness in the opposite part of the body, cranial nerve defect, difficult with vision, moving the eyes, swallowing, and so forth. It all depends on the location of the tumor.
Are there certain locations in the brain that are more difficult to treat, or if you have a brain tumor here, it's worse than having it here?
Well, for obvious reason, if the tumor is located at what we call a skull base, so at the base of the brain, it's more difficult to reach. So the surgery in that location is more challenging, more difficult.
Okay.
And also because there are cranial nerves, vessels important to the brain that you have to deal with when you dissect those tumors.
Okay. So if someone is presenting with some sort of symptoms, we don't want everyone with a headache or some blurry vision to head to their doctor and say, I think I have a brain tumor. But if you think it might be something more than that, what do you recommend for people?
First of all, what is a headache that needs to be worked up? And not a headache.
I had a headache this morning.
That's what I'm saying. First of all, if you have had headaches for 20, 30 years, if you start having headaches when you were a child, and the headache has not grossly changed, you know that it's migraine headache.
Right.
So you don't have to worry about it. You have to treat it symptomatically. But if you're 30, 40, 50 years of age, you never had a headache before, and all of a sudden you start developing a remarkable headache, that's something that needs to be worked up, because it's not normal for an adult, unless there are other causes, like you have a sinusitis, you have an infection, or you have something else going on, but unless there's something else happening, a new headache needs to be worked up. Because it doesn't necessarily mean there's a brain tumor, but it could be due to something else.
Okay, so that process usually starts with seeing your general practitioner?
Typically, yes.
And then at what point do they see a neurologist or someone in your profession?
Once the basic workup has been done, and typically head CT or an MRI, and the basic diagnosis has been done, we usually get referred the patient.
Okay, so how do you, I was going to ask about diagnostic tests. How do you decide it's an MRI? Does it require an MRI or a CAT scan?
Well, the MRI for brain tumors is the most important piece of information because it gives a lot of information about the tumor surrounding the brain. But in the beginning, sometimes it's easy to have a CT scan and access, easier to get a CT scan. So you do a CT scan. CT scan shows an abnormality or shows a tumor. You want to better characterize it. You get an MRI with and without contrast, and we get all the information we need. And sometimes we need to do more. We need to look at vessels, so we get some more tests. But typically, an MRI with and without contrast give us 95% of all the information we need to have.
Okay, so then what's next then? You've got all this information. How do you go about deciding to treat it? Because there's, we've talked about these 4 different types and where it's growing, how it's growing, the location. It's complicated.
It's relatively complicated, but at the same time it's simple.
Okay.
Because first of all, when you look at the imaging, we get an idea in more than 90% of the cases what we're dealing with. And first of all, is this a tumor that seems to be more benign or more malignant? Is this a tumor that is causing symptoms or just an incidental finding? Quite often people have car accidents, get an MRI or a CT because of the car accident, and we discover a brain tumor. So if we're dealing, for example, for an incidental finding tumor like a meningioma, that is a relatively benign tumor, that is not causing any symptoms, is not compressing much of the brain, we don't need to do any treatment. We just watch the tumor with the MRI every 6 to 12 months or every 2 years and see if it grows. And if it changes characteristic or the growth pattern increases, then we'll address it. The large majority of the tumor come to our attention because causing symptoms, and so they need to be treated. And typically surgery in the large majority of brain tumor is the #1 treatment because it's the one that provides the mass relief that needs to be obtained. Sometimes brain tumor, like benign brain tumor of the acoustic nerve, like I said before, the one that arises from the inner ear, and they are not very large, can be treated with what we call stereotactic radiosurgery. So a focus beam of radiations that just go to the tumor, do not make the tumor disappear, but stop the growth of the lesion and quite often improve symptoms.
What about chemotherapy for brain tumors?
Chemotherapy, for obvious reason, is reserved for malignant brain tumor. The challenge in the past with chemotherapy is because of the existing blood-brain barrier, means nutrients, substances from the blood, they have a difficult time to reach the brain cells because of the tight junction between the vessels and the brain cells. And so also drugs, medication have a difficult time to get there. So many chemotherapeutic agents used for other tumors into the body do not work for the brain just because they don't access the brain.
Because they can't get
They
there.
can't get through it. They cannot get to the tumor because they cannot get to the brain. There are some that are used and can be quite effective. Temozolomide is one of those, the most used one. And they are widely spread in malignant brain tumor.
So let's talk about surgery. First, let's talk about, you see this in movies or maybe on TV, someone has an inoperable brain tumor. And what makes something an inoperable brain tumor? And you're done.
Yeah.
There's nothing you can
Unfortunately, sometimes we are facing patients for the first time. They come to you, they don't know anything what's going on, and then you have to lift your arms up and say, I'm sorry, there's not really an effective way of treating you. What are those cases? Well, we mentioned about, for example, the GBM, the glioblastoma multiforme. We mentioned about the malignant brain tumor that tend to infiltrate the brain. Now, if those malignant brain tumors are still localized within certain part of the brain, then we can access them and remove them and greatly improve prognosis, although we don't cure them. But if those lesions are diffusely infiltrative and they go, for example, from the right side of the brain to the left side of the brain, across the midline, infiltrating what we call deep basal ganglia, all the deep structures of the brain, that tumor cannot be resected, and there's no way to develop an algorithm to effectively treat this type of lesions, and they usually call the demise of the patient even within weeks sometimes.
So how do you, when you're in there, in the brain surgery, what technology is there so you're just cutting out? Because we can't really live without parts of our brain, or can we? Can you take parts of the brain out along with that tumor and still be okay?
I can respond to that question in twofold.
Okay.
Number one, yes, we can live without part of the brain. But before we go into the portion of the talk, I say most of brain tumors cells do not function. So when the cells divides and becomes tumoral cell, it's not a functioning cell. So as long as you remove tumoral cells, you don't affect any part of the brain. The rest of the brain works normally. And that's what do we need to define in surgery. We need to define the barrier, the border between the tumoral cells and non-tumoral cells, working cells. We develop that, so we tend to remove the tumor and leave all the brain behind. The challenge sometimes is when you have a tumor that is in a very important part of the brain, where we have to do microdissection and make sure we don't affect the normal brain. And it happens sometimes that after surgery, the patient may be a little bit weaker if the tumor is located in an area that controls the movement. But in the large majority of the cases, they tend to recover and get better after a few weeks.
So is technology is always improving your job. What are some new things that have come into play in terms of brain surgery that make your job a little bit easier?
Well, some tumors, mostly the low-grade tumors, the more benign tumors, but still infiltrative tumors, are difficult to differentiate between normal brain and tumor brain.
Okay.
Because when you have a malignant brain tumor, it's clearly evident the difference between the tumor and the brain, and we know where to stop and where to go. Sometimes in lower grade tumors, the tumoral portion is not that much different between the normal brain. So there are aids that we use in surgeries. We have what we call an intraoperative ultrasound. So it's an ultrasound probe that we use on the brain to differentiate where the tumor is or where the brain is, where the different structures are. Also, we have a neuronavigation. A patient before surgery acquires an MRI with what we call fiducials marker around the head, where, without being too complicated, through a computer calculation, we map every single part of the brain with a margin of error that sometimes is within 1 millimeter. So we use this neuronavigation to guide us where we can go, where we should stop, how deep we need to go, and so forth. There are other techniques that are newer, injection of fluorescent, some markers that tend to infiltrate or just go into the tumoral cells and differentiate the tumoral cell from normal surrounding brain. And then with we do all this procedure under the microscope, so we have a high magnification and we have a great vision of what we're doing.
So when you're doing, there's nothing probably classified as typical brain surgery, but when you're doing surgery on someone, how long does that surgery take?
Surgery may take several hours. The typical brain surgery takes 3 to 4 hours.
Okay.
But it all varies between, shorter case between 2.5 hours to even 12, 16. The longest surgery I've ever done is 23 hours.
Oh my goodness.
So sometimes very large skull-based lesions are challenging, and you need to spend quite a bit of time with them.
You had said to me before we started taping that the brain tumors are fascinating. Are they fascinating because they can be so different, you don't know what you're getting into because it's in the brain? Are tumors in the brain just completely different than tumors somewhere else in the body?
The behavior is completely different.
Okay.
Because although malignant tumor in the body tend to be aggressive, but not only tend to infiltrate the local organ where they arise from, but also give metastasis. So they send daughter's cells to distant organ. And that becomes the challenge in treating those tumors. In the brain, the large majority of brain tumors do not metastasize. They stay in the brain. But the challenge is they tend to infiltrate the brain so much that it's difficult to chase all those cells and kill them. And that's one of the challenges. And the greater challenge is, think about what we are. Everything we're doing is due to the brain. I say the rest of the body supports the brain.
Right.
But what we are is what is in the brain. So by working in that environment, you have to be really respectful of every single movement, everything you do.
So you had said, if you have maybe breast cancer, it can spread to the brain. So can a brain tumor really can't spread to the rest of the body? Does it usually not go that way?
Usually it doesn't go that way. It stays within the brain, it doesn't go anywhere else.
And you had said earlier that people can have a brain tumor and live with it for a while. It can just sit there and do nothing?
That's right. There are quite often tumors that grow slowly for years and years and years and don't become clinically relevant. Some people may ended up having a normal life, living 80, 90 years of age, still harboring a benign brain tumor for which nothing was done. So it all depends what type of behaviors or what type of tumors we're facing. Okay. We can face a little cat or we can face a tiger.
So when you started in medicine, what was it about brain tumors in the brain that fascinated you? And
well,
you
I started to be fascinated by the brain, by the function, by all the things we know and we don't know. And then it came as a consequence that becoming a surgeon, I wanted to spread my passion into brain and brain tumors because they are so challenging, not only from a technical point of view, but even more from a genetic point of view and from a treatment point of view, because we have made so many improvements. Many malignancies have been treated effectively and cured, but we are still not able to cure malignant brain tumors.
Well, that's what I was going to say. Has the survival rate for brain tumors gone up in the last, 10, 20 years?
It's been somewhat improved, but not to the point that we wanted to have.
Right.
For example, if you want to look at some figures, again, GBM, one of the most malignant brain tumor. If we don't provide any treatment, there's been some studies done. If we don't provide any treatment, no medication, no radiation, no surgery, the average life expectancy from the time of diagnosis to the time of death is 6 weeks only.
Oh my goodness.
Now, with the full treatment, it means surgery that tends to remove the large majority of the brain tumor, plus some adjuvant chemotherapy and radiations, we're still averaging around 13, 14 months. So it's definitely much better, but still not where we wanted to be. Of course, we have longer survival.
Right.
And I have patients right now I'm following with 3-4 years after surgery, they still are tumors free. But unfortunately, the mean survival is around 13-14 months for glioblastoma multiforme. And in fact, talking about survival, we can say the World Health Organization divides the brain tumor in 4 categories. The benign called category 1. The 2 that are still low grade but tend to infiltrate the brain. The 3 and 4 are the malignant ones. And in fact, the survival changes. If you are in the category 1, people can be cured from their tumor. You remove it completely and typically it doesn't come back. In the grade 2, although you remove them, but they still tend to slowly infiltrate the brain, and also the grade 2 can become more malignant. So probably when you talk about grade 2, the average life expectancy is around 7 years. When you talk about the grade 3, we are 3 years of life expectancy, and then the GBMs, we say just above 1 year. So we can see as they become more and more malignant, the prognosis worsens.
So are there any known causes of brain tumors? I mean, we know that smoking causes lung cancer and other things. Are there any distinct causes for brain tumors? Does repeated head injuries, is there any link between that or diet or obesity, any of those things?
What we know for sure is the genetic link to certain diseases. So there are certain conditions inherited that can increase the chances of you having a brain tumor. But besides those, if you talk about the general population, we mentioned before, there's not a proven link to anything specifically. We talk about radio frequency waves. Some people talk about pesticides. But there's no direct link like could be between lung tumor and smoke.
So brain tumors are just one of those things that you
It's
can't
still
really
sometimes
prevent.
a mystery.
It is a mystery, just like the brain continues
Yes.
to be a bit of a mystery. Well, Dr. Nardone, we're all out of time. I want to thank you for stopping by. I know you're busy fixing brains and fixing spines in our region, so thank you for stopping by and talking to us. Thank you.
Thank you.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles. Eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Being Well is also available online at our YouTube channel, youtube.com/WEIUTV. Just look for the Being Well playlist. Here you can view current as well as past episodes.